Opioid use has been on the rise across the United States, and St. Louis City has been hit hard. Recovery from opioids can be extremely difficult, but Dr. Sharon West of Affinia Healthcare is here to share how her program can assist users who want to quit. Thank you so much for doing what you're doing, because I don't think people realize how big of an epidemic this is. Now, I had to go online and look it up because I wanted to know exactly what was an opioid. But let me ask you to tell our listeners, viewers,
about the opioid addiction.
what is it? What's an opioid?
Well, it could be different things. It could be heroin. When we talk about opioid addiction, it could be oxycodone. It can be fentanyl, which is the newest, most synthetic opioid out there, and it's 50 times stronger than heroin.
I want to talk about that. You know, I think most people think when they're thinking opioids, oh, that's heroin addicts. But I don't think they realize that 50% of all the opioids that are out there right now are prescribed.
Prescribed. They can be oxycodone that you can get when you have a car accident or a dental procedure that your doctor could prescribe, and over time people become addicted to it, and then they graduate to other means to feed that addiction.
And you mentioned fentanyl. It's so serious. You were telling me a story about a police officer. Would you mind sharing that story?
Absolutely. It is so powerful. It's 50 times stronger than heroin. It's a synthetic heroin, and it can absorb through the skin, and people may think it's like folklore, but a police officer actually got some on his hand and it absorbed through the skin, and he went into an overdose. He's okay now, but that's how potent this drug is.
What does it do to your body?
Oh, it wreaks havoc on the body in terms of addiction. It becomes a physical addiction, and it becomes a psychological addiction. It just takes over your entire life, what opioids will do to your family, your life, your body. And that's why we say we're taking it to the mat. We need the medication-assisted treatment to help people kick this addiction.
Which is what MAT stands for, medication addiction assistance treatment.
Yes.
Right. You know, and it's so serious that 62,000 people in the United States alone died from opioid overdoses last year.
Absolutely.
But what something else I thought was just crazy was that in not even 20 years ago, in 1999, 4,000 people were reported death from opioids.
And the rise, how quickly this rise has come about, yes.
And 18 or 19% or something like that between 2015 and 2016, which just goes to show you that it really is an epidemic, and how important it is for people like Affinia and Matt to really deal with this program.
Because this addiction doesn't know anything about age or class or race, doesn't know anything about that. So it's an equal opportunity addiction.
And if you have, whether you have or don't have medical insurance, but somehow the doctor prescribes this because this is what you need and you get it, and then something that innocently started like curing pain turns into
an addiction.
That's really tough. That's a really tough thing to think about and to handle. So tell me some of the things. How does it affect someone's family or their home or themselves when they become addicted to opioids?
It's destroying families, it's destroying lives, it's destroying communities. Because when you have an addiction that you steal for, or that you lie for, that you just do anything to feed, families are destroyed, divorce rates go up, crime goes up, people, they lose their jobs, they lose everything. Not to mention how their physical appearance really alters from using this drug.
And another like sad statistic, and so I can get all the sad stuff out of the way, and we can take a break and come back and talk about the positive things that are being done right to help it, is that it's the #1 cause of death for people in the United States under the age of 50, which is just mind-blowing.
Startling, isn't it?
Mind-blowing. Anyway, that's enough bad news.
It's enough bad news.
Let's take a quick break, and when we come back, let's talk about the good news and the help that's out there for people who are suffering from an opioid addiction. We'll have more with Dr. Sharon West and Affinia's MAT program after this. Stay with us for more STL Live.